So we had a meeting today, premiers of the provinces and territories with Prime Minister Justin Trudeau. Provinces and territories form a united coalition that will fight to the end so that the federal government does its fair share to fund health care. Unfortunately, despite the Premier's unanimous demand, Justin Trudeau refused to commit to substantially increase health transfer. He said that it was premature because of the COVID-19 situation to have this discussion. We think that it's more important than ever with the COVID-19 to discuss this major problem. Healthcare funding has become a daunting problem for the provinces and territories. Even before the pandemic, annual provincial health expenditures rose by roughly 5% a year, but revenues only increased by 3.2%. Reason for the 5% increase is because of the impacts of aging of the population, cost of new technologies, and cost of new drugs. And COVID-19 will worsen the problem. We are all aware that the federal government has invested heavily in 2020 because of the pandemic. We acknowledge it. However, most of the expenditures are non-recurrent, which is the crux of the problem. Before new expenditures are incurred, we hope that the federal government will first do its fair share to satisfy Canadian needs through recurrent transfer. Despite the deficit, the federal government will, in the coming years, be in a better financial position in relation to the provinces and territories. Federal government revenues are growing faster than the province's revenue because of the bigger proportion that personal income taxes represents. Recent forecast by the Ministry of Finance in Quebec indicates the federal government revenues are increasing by 3.9% compared with 3.2% for the provinces. Also, the Ministry of Finances in Quebec anticipates in 10 years, so for the year 2030-31, a balanced budget in Ottawa, but a deficit of more than $100 billion for provinces and territories. That's why the provinces and territories are in an untenable situation. That's why we're requesting that the federal government increase its contribution to health expenditures from 22% to 35%. This means increasing its annual transfer by $28 billion from 42 to 70 a year. Our request, we think, is realistic, reasonable, given the province's anticipated deficits. It is time for the federal government to again become a full-fledged financial partner. We need recurrent budgets from the federal government to help pay for hiring staff in hospitals and in residential long-term care centers. So what we're asking to the federal government is a fair, equitable partnership. And of course, we think and we were very disappointed of the answer of Mr. Trudeau, who refused to discuss that right now.